Hello, I'm Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical experience. And today's topic is, well, I'm too healthy to go to the doctor. I hear this a lot. I hear from patients, I haven't gone to the doctor for years. I don't have any problems. I don't need to go to the doctor. And I hear from men as well. Some of my friends avoid the doctor like the plague. None of us likes to go if we don't need to. Nobody wants anything unnecessary. But a lot of the phenomenal progress we've gained in healthcare, in life expectancy, in keeping people healthy and able to do all the things they want to do is with prevention. If you wait till you have a complaint, if you wait till you have symptoms or problems, then you're behind the eight ball. You're not getting ahead of a problem. And everyone, and I mean everyone, eventually gets some health issues. And that is why we have many screening procedures in place, many preventative measures in place, and throughout a person's entire life. And they're different at different ages. I'm going to run through a few of them and give you a little anecdotes and hopefully inspire you if you're one of those healthy women or even men who haven't seen a doctor in a long time, and there's got to be something picking at the back of your brain, making you wonder, making you think, that's making you watch this video. So I hope I'm going to encourage you to go. And I also want to tell you that if you are thinking about something or you're worried about something, sometimes it's easier to stick your head in the sand and deny it and think it's nothing. It won't go away. I mean, it'll just go away. And if you go to the doctor, you might end up going down a rabbit hole and getting in trouble. And we're in the healthcare community here set up to try to help you and to help guide you in your care, and you always have options. But if you don't have the right information, you're eliminating many of the potential options that could keep you well much longer, keep you healthy much longer. Okay, so one of the great screening things that we have is Pap smears. Pap smears have revolutionized the care and prevention of cervical cancer. Still, the #1 female cancer in third world countries where they don't do Pap smears, but vanishingly small in the United States and in other advanced countries that use regular screening. So currently, Pap smears are recommended starting at 21 years old. We used to do them as soon as a woman was sexually active, but with time and education, we've discovered that women's bodies are sometimes able to cope with the virus, the HPV virus, and intervention too early could be a problem. So that's why we delay. Unless you have some immune compromised state, we generally wait till you're 21 to start doing Pap smears. Pelvic exams, however, occur earlier as soon as you're sexually active. If you're sexually active, you should get screened for sexually transmitted diseases. The vast majority of women who I treat, and I regularly treat them every week, do not know that their partner had an STD. No one comes in and says, hey, I think I have an STD. My partner said I had one and we decided to have sex. It's the opposite. So if you're thinking you don't need screening because you know your partner, well, men can have symptoms. Men can have a sexually transmitted infection and have no symptoms. So if you're sexually active, the CDC guidelines are to get yearly screening for sexually transmitted diseases until at least age 25. And then if you're in another high-risk circumstance or if you think you had an exposure. So that's some of the screening that we do. There's other videos that I go over on mammograms. I encourage mammograms. I'm not going to get into detail there, but catching breast cancer early can have a significant impact on your outcome. If you are, so this is a quiz that I do for my patients often. What do you think your lifetime risk of getting breast cancer is? 1 in 10, 1 in 100, 1 in 1,000, or 1 in 10,000? Now, most of my patients who are always healthy and avoid doctors don't have the exact answer, but they know I'm trying to catch them. So the most common answer I get is about 1 in 100 or 1 in 1,000. Well, the right answer is 1 in 10, and actually that's the wrong answer because the average lifetime risk today is 1 out of 8. So I don't even give the right answer as an option. 1 out of 8 lifetime risk. Now, 1 out of 2 of us all get heart disease, stroke, heart attack. So we all eventually die of something. We have a 1 out of 1, 100% chance of dying of something, right? But with that higher risk of 1 in 8, it's worth getting the recommended screening. And if you want to know more of what that is, then I encourage you to watch my other video on mammograms. There are other screening tests for colon cancer. Colon cancer screening has now been moved more aggressively from 50 to 45 because the rate of colon cancer has increased. So all of these screening procedures are when you're fine. And the idea is to catch things early, because if we catch things early, we can change the course of your life. We can keep you healthy, alive, and well like you've been all these years for a lot longer. And I can't tell you how many patients I have, really at least 2 or 3 a year, who come in to me and say, I haven't seen a doctor in years. I've always been healthy all my life, and they have a very advanced, serious problem, and they only come in when they have serious problems like advanced breast cancer or a very serious infection, a sexually transmitted infection that has made them seriously ill and interfered with their ability to get pregnant, and that gave them chronic pelvic pain for the rest of their life. Whereas if they had just come in for the screening and not waited the many weeks and months it took to get that sick, they would have been much better off. Okay, so I encourage you to find a healthcare provider that you trust, that you get along with, and to talk to them about what's an appropriate screening for your particular circumstance. Hope you found these comments helpful. Please leave your comments as well. Thank you.